Florence Nightingale is famous for organising female nursing in the army hospitals at Scutari in the Crimean War. What she learned from that experience helped her to change the lives of everybody in England. The British government suppressed her written report, but she knew that the secret of Scutari held the key to reducing the high national mortality from epidemic disease. It's taken over a century for science to accept that she was right, and for historians to discover the secret report that she hid in plain sight. Before the war, she was one of the few powerful women in Britain. She was the chief executive of a hospital in London's Harley Street when the government sent her to Turkey to help to manage the military hospitals. Britain was at war with Russia, which had invaded the Balkans. While she was on her way to Turkey, the Russians nearly defeated the British army at the Battle of Balaclava. The British hurriedly decided to evacuate their sick and wounded to Turkey, out of fear that the Russians would capture them. The biggest hospital was a huge army barracks at Scutari on a cliff top opposite the old city of Constantinople. Winter soon set in, and the hospitals became crowded with men who were suffering from exposure and malnutrition due to difficulties in supplying the army. Thousands of sick soldiers died in Nightingale's hospitals in the months after she arrived. In the single month of January 1855, when there was no fighting, 1/10 of the entire British army died in hospital. At Scutari, Nightingale, her nurses and the dying patients remained calm as the disaster unfolded.
Daily we miss some pale face we had just learnt to know and love, and who loved us. In the course of a few days, almost all who had been entrusted to us were gone, and were succeeded by others who seemed equally doomed to die. It seems strange we could calmly witness such horrors and not be overcome and agitated by them. But both to the poor sufferers and to us there seemed granted a calm and patient temper, to enable us to go through these scenes in a sort of stunned feeling. For could we have fully realised all their sad sufferings, and all the bright hopes and young lives, and all the love and care of relatives, all quenched in misery and death, we could not have borne it.
Nightingale patrolled the hospital at night. There were several miles of corridors. One night the same nurse followed Nightingale to the dead house where the day's corpses lay.
It was an awful place to visit at any time, and as I waited at the door I saw her quietly uncover the faces of the dead and look on them as they lay in that dreary place. It seemed strange to see one so frail, graceful, and refined, standing at the dead of night, alone in such gloomy scenes of mortality.
The army kept sending more sick soldiers to Scutari. Nobody was telling the army in Crimea about the high death rate among the patients there. After about 4 months, some officers from Crimea came to see for themselves. What they reported back convinced the army to stop evacuating the sick. Someone must have blamed the conditions in Nightingale's hospital, because Nightingale wrote to the Minister of War 6 months later denying this. She said that the army had sent her patients who were already dying.
The men sent down in the winter died because they were not sent down till half dead. The men sent down now live and recover because they are sent to time.
By the time Nightingale wrote this, in August 1855, the high death rate in her hospitals had fallen. The government had sent a very experienced civilian doctor, Sir John McNeill, to improve the supplies in Crimea. McNeill reported that inadequate rations had been causing the high death rate. Nightingale and McNeill became close friends, and she took his side in the blame game that followed. McNeill blamed the army for starving the troops. The army blamed the civilian commissariat for not providing the right supplies. Queen Victoria accused McNeill of exceeding his authority by investigating the army instead of the commissariat. The war ended, and Nightingale went home in April 1856 determined to defend McNeill. She enlisted the help of the chief statistician at Somerset House, Dr. William Farr, who had already analysed statistics on the death of the cavalry horses in Crimea. Nightingale wanted Farr to confirm McNeill's theory of starvation. Farr had contacts in the army who gave him some data on death rates in the different regiments. His analysis showed that those regiments that had sent more patients to Scutari had a higher death rate. There were 4 army divisions in Crimea, and the red column shows the proportion of patients dying at Scutari compared to the black column for those remaining in hospital in the Crimea. Nightingale now changed her mind and concluded from Farr's new evidence that the unhygienic condition of the hospitals at Scutari had caused thousands of unnecessary deaths in the 7 months between her arrival and the Army's decision to stop evacuating patients. She'd put her reputation on the line to widely publicise and support McNeill's argument that it was the Army's fault for sending her patients who were already dying. Now she had to accept that she had been wrong and that her hospitals had been at fault. She had wanted to be an expert on hospital administration, but now she began to study building hygiene. Her new mentor, William Farr, was the ideal teacher. He was a radical former medical practitioner who was the most scientifically qualified advocate of new ideas on sanitation, meaning reducing overcrowding and installing running water and drainage in homes. He believed that these would increase human lifespan, especially among the poor. His humble position made it hard for him to influence government policy. The government that had sent Nightingale to war had cut back public spending on sanitation, and that was why they had not sent anyone to check whether the buildings at Scutari were healthy. Nightingale had always held radical views, and now she adopted Farr's political agenda. She wrote a long report to the Minister of War, quoting Farr's statistics. She described how her hospitals had been nothing short of a death camp while she was there because of the government's neglect of sanitation.
We shall see how much of the mortality was due, in the Crimean case also, to the frightful state of the general hospitals at Scutari. How much it depended upon the number which each regiment was unfortunately enabled to send to these pest houses. The operative causes of our great mortality were 1. Overcrowding of the patients in the buildings, so that it may safely be said that treated under a hedge they would have had more chance of recovery. 2. Extremely defective drainage.
She wanted the government to publish her report, but they refused. After 12 months, she leaked it. She had dozens of copies printed and sent them to prominent and trustworthy citizens throughout the country, insisting that they keep the information secret. Many recipients bequeathed their copies to libraries where the secret of Scutari was ignored, hiding in plain sight. She openly published one item from the report, her famous diagram showing that, contrary to official medical opinion, it was possible to reduce deaths from epidemic disease by improving environmental conditions. This was the start of her campaign to turn William Farr's proposals into public policy. She wrote alongside this diagram,
Let us now ask how it was that our noble army all but perished in the East, and we shall at the same time learn how it happened that so many hundreds of millions of the human race have by pestilence perished before their time.
She meant by this that the lesson of Scutari was that improving domestic sanitation could save millions of lives. It took her 15 years to get the necessary environmental health laws through Parliament, against strong opposition from the medical hierarchy and from big landlords. She was driven by the memory of the common soldiers who died unnecessarily in her hospital despite the best nursing care.
When I look back to what those slaughterhouses were when we first came to them, it seems to me like a horrid spectre one is afraid of conjuring up out of the dark corner of one's mind.
Schlaf nun